Your back is injured, and the physios are constantly saying your back's tight and stiff, you need to bend it more. No, you have an injury. If I've just sprained my wrist off to the side, I don't repeatedly bend it over and over. What I often notice is that the tissues actually are a bit inflamed for the time being, and the wrist is a little bit stiff. But as the wrist heals, I then notice all of a sudden, or slowly, that my wrist range of motion has restored once the integrity of the tissues has rebuilt. Rather than trying to force in more and more instability into this area, we need to acknowledge that stiffness and a feeling of tightness, a feeling of, if you imagine two sides of a wound trying to knit back together again, that is happening in the lower back. And so it's perfectly reasonable to have that stiffness in the lower back. Use tools that manage that stiffness effectively, such as the massage gun on the lower back musculature here. That can be remarkably relieving. Yes, it's temporary, but it's worthwhile doing, and it does not involve you going and doing the very thing that injured the back in the first place, which is rounding over again and again. So a couple of things there. Hopefully that's helpful.